today because it's really reflect the culmination of a lot of work that has happened over the past year. We're going to talk about some reflections and legacy of the AIM program's research support facility. I don't think the AIM RSF needs a lot of introduction, but I perhaps wanted to start with, before introducing our speakers, to set a little bit the scenes for the AIM and the RSF. It's you may or may not remember. Some of you may have not been with us when we started, but we were given a task, a challenge by Chris Whitty back in 2019, 2020. It was just before the COVID pandemic, to look at recent development of artificial intelligence, see whether we could exploit them somehow to better understand multiple long-term conditions and how they long-term conditions cluster together and how they develop over time. So we were trying to figure out a way to design the program in a way that makes sense. As we were consulting with experts, we identified some important structural and cultural challenges and perhaps innovation barriers, I don't know if that's the right term, that tend to lead to suboptimal care for people and who are affected by multiple long-term conditions. And some of those are now well known thanks to the AIM program and the work of the RSF, siloed clinical practice and structures that make for generally poor data collection, poor data access, lack of integration across specialties and sectors, limited collaboration between artificial intelligence and clinical and practice communities, challenges in getting AI expertise, particularly because it's concentrated either in some affluent areas or in the private sector, increasingly so, to be honest, even now. Tension between competition and the need to tackle complex challenges collaboratively within the academic culture, and social or legal or ethical concerns around the AI implementation. So a number of challenges that we identified very early on in the development of the AIM program and the design of the AIM program that then translated into the structure that we know today, with a number of large research collaborations that are trying to deliver specific objectives and goals in the long-term condition space, and a research support facility that we intended as a facility to support the collaborations that we funded without necessarily being burdened by objectives of delivering specific outcomes for the research. So that was the original idea. But then it's the RSF team that implemented and refined that idea through their work. So this is the opportunity really today to hear from the experience of colleagues that have delivered the work on the ground. We'll be hearing from Emma about the open science approach and the RSF work around patient and public involvement and engagement and early career researchers. We'll hear from Chris about horizon scanning and data and some of the developments in that space and how perhaps that space has evolved over time. And then we'll hear from Mon about case studies and the legacy aspects of the research support facility, with a particular focus on lessons learned. So without further ado, I'd like to open the floor for Emma, Chris, and Mon, who will introduce themselves in a much thorough way. Thank you very much.
Thank you, Mary. I'll just share my screen now. So please let me know. Everyone can see themselves, which they don't want to see. Okay. Brilliant. Thanks. Thank you, Vitor. So thanks for that lovely introduction, Mario. And I'm Emma Caroon. I'm a principal researcher at the Alan Turing Institute, and I've been involved in AIM RSF, actually from the start, as I was line managing some of the community managers who were involved in PPIE and the ECR networks. And then I became involved myself running the ECR network. And now I've actually become the PI of AIM RSF to bring it to the closing point. So I've been involved all the way along in different ways. I'll pass over to Mon so you can introduce yourself.
Lovely, thanks Emma, and lovely to see so many familiar faces and a few new ones. So I'm Mon Fletcher. I've been involved in theme 5, which has been about the legacy and also about really promoting the learning from the RSF into the wider community. It's really interesting with all the changes that have happened during this time. I started my journey with Edinburgh University, and then Aziz Sheikh, as many of you will know, moved to Oxford. So I now have an honorary contract with Oxford and Edinburgh University. So it's great to be here and to share some of the insights that we've had. And I'm going to pass over to Chris.
Yeah, thanks, Mon. Hi, everybody. So I'm Chris Orton. I'm Head of Business Development for the Security Research Platform and Sale Data Bank at Swansea University. I've acted as the strategic and operational lead of Theme 1 for the AIM RSF, which is essentially on reproducible infrastructure and data insights. And I've worked very closely with all of the themes across the RSF to ensure that that sort of technical input has been factored into all of their work. Hopefully what I'll be presenting today is obviously some applied use cases that we've been able to work alongside the consortia on throughout RSF's history, but also looking forward how the legacy of those outputs and also the work that we're doing, including the event I'm currently at, might actually factor into data developments and infrastructure moving forward. So nice to see all of you.
Thanks, Mon and Chris. I'll just go on to the next slide, which is a little bit housekeeping, which is that the talk today is being recorded. We have also decided just prior to starting that we're going to record the discussion because we think that's going to be a really useful discussion for people to see. So if you don't want to be on the video, please remember to just keep your camera off. If you want to do questions, you can do those in the chat function. If you don't want to be on the video, or you're very welcome to raise your hand. We're going to take questions at the end after mine, Mon's and Chris's presentations. If you have any issues during today's meeting, please contact Batul through the chat. And we do have a code of conduct, which you can see on the slide there. So Mario has already introduced, I'm going to skip a little bit through these slides. As you all probably know, the AIM AI for Multiple Long-Term Conditions program was set up by NIHR, and they've invested 23 million in actually 8 now research collaborations that have brought together academics, healthcare professionals, AI experts, and other related practitioners. So as Mario said, the purpose of the AIM program was really to develop insights into the identification and prevention of MLTC. And the idea was to bring together or bring in advanced data science and AI methods to identify clusters of new diseases, but also look at how diseases developed over the life course. The program also had an aim to grow capacity and capabilities within this type of research, so multidisciplinary and interdisciplinary work within the MLTC research and wider health research ecosystem. So in addition to the program, they have NIHR very lovingly have funded us, the AIM RSF, the research support facility. And already Mario said as well that this was an idea, the whole AIM program and AIM RSF, that came from Chris Whitty. At the time, actually, Turing's health leadership, so Chris Holmes and Katrina Payne were working quite closely on some other things with Chris Whitty, and so it kind of came about, the kind of connections came about that way as well. And what is the AIM community? So the AIM community actually is really large. So the program and the research support facility itself, it actually has involved 27 universities, 12 NHS trusts, as well as charities, city councils and public involvement organisations from England, Scotland and Wales. So a really large community working together. And so focusing now on the AIM RSF, it's a collaboration initiative led by the Alan Turing Institute, but very much in partnership with Swansea University, University of Edinburgh, and now the University of Oxford as well, as Mon said. And really what we've been doing is overseeing the 8 AIM research consortia across the UK to support and try to drive forward this kind of culture change in how MLTC research is being done. What we are is a dedicated resource made up of small groups of data science experts, which we refer to as themes, to support the AIM Consortia research groups. And really the RSF team focuses on 5 key areas. So building robust infrastructure, improving data accessibility, creating a connected research community, engaging with patients and the public, and also ensuring lasting impact. What we have done is taken a really flexible approach to problem solving in the AIM Consortia. This means opening up knowledge sharing to understand the progress of projects and any barriers, and then being agile as a team by deploying experts where needed, so acting to plug these short-term capability needs. And we've also acted as a long-term capacity building mechanism for these research groups and the wider health data ecosystem by creating communities and networks and providing training and support in key areas such as PPIE, so patient and public involvement and engagement, and also open research best practices. So this research support facility is really an experiment funded by NIHR. As Mario said, we weren't really told all of what we had to do. It was really much in development by us working consortium. And as far as we know, we don't think any other such unit has actually been this strategic unit has actually been supported on as a unit working across funded programs of work. So it is quite a unique experiment. So I'm just going to go on to talk about our open science approach and some of the different elements that kind of feed into that. So really to boost the impact of our work across the AIM programme, we have taken this open science approach to our work. So this approach, what I mean by this is just really opening up all of our work as much as possible to make it accessible, to make it inclusive and reusable by the AIM community, but also by anybody, because openness means really open to the public, open to anybody. So this has involved establishing open knowledge sharing through things like having internal meetings and external meetings, also having multiple communication channels to kind of share all this knowledge around. Also enabling an inclusive collaboration through things like facilitating hybrid conferences, focusing on accessible language and co-creation with all of the stakeholders that need to be involved in their research. We've also focused on building open communities to allow networking, learning and collaboration across the programme and also beyond, and also ensuring open publication of all our activities, resources and publications to allow our materials to be used and reused. So, so the early career researcher network, with particularly I've been involved in through, which is our theme 3 of AIM RSF. What we have done is created this community of early career researchers across the whole AIM programme. One of the things we spent time on was actually defining, or actually not defining, what ECR was. We actually wanted to make sure that it was an inclusive community. So the kind of ECR badge was a very broad one. It involved lots of different types of researchers and others in the programme. What we actually did was we had regular lunchtime sessions, a bit like this one, where we had presentations, but also lots of discussion. So we met monthly, so to build this community. We also had an ECR reps committee that I worked with. So from each of the consortia, they nominated an ECR to come onto the committee, and we worked with them. And they helped us to guide and develop the actual network itself. And actually, I found that throughout the programme, they took on very emerging leadership roles, such as one of the ECRs actually helped us to develop and ran one of the in-person symposia that we put on. And we actually put on 3 different symposias where we brought together this ECR network, and we did training and discussions and presentations, and had a really 3 really valuable days together. We also did part of the ECR network was providing a lot of training to them, which I won't go over that. So next is the patient and public involvement and engagement. So 2 of the things that we did, because there were lots of them within the programme, was that we formed this PPIE community of practice, which was actually a collaboration with a group that was outside of actually the AIM programme. And we came together to bring this community of practice together because we were very aligned. The community now has over 150 people with lived experience, carers, PPIE professionals and also researchers. They ran monthly meetings, they did workshops, and really they did work that the community wanted to do. It was very community led. And actually, I think one of the real special things about that community was that it is a blended community. It is bringing the researchers very close to the PPIE representatives, the people with the lived experience and the carers, so they can really, really learn from them and actually bring that back into their research. The other thing we focused on was making everything accessible, and one of these aspects is accessible language. So the community manager, Sophia Batchelor, actually started to a process of co-creating a glossary that we could actually use throughout the programme. And you can see there's a QR code on this slide for that resource. I've only got a few more to go now. So, so in terms of online training, we actually created a bespoke training programme for the AIM researchers. We put out surveys to ask them what they wanted, and then we really developed the training ourselves. We brought in the experts from across the Turing and outside of the Turing to actually do these trainings. So all of our trainings were things like version control, about fair publishing, about particular coding languages that could be learnt, working with data, but also things such as public engagement as well, and things that were really useful to early career researchers, such as grant writing and writing particular types of CVs. So things that again build the capacity within the programme. We also put on open seminars monthly, such as this one throughout, which had lots of different speakers, initially speakers who were a bit more external, but actually then loads of speakers from the AIM programme themselves talking about their particular research themes, which were really valuable. And all of the training resources and the seminars can be accessed openly online. And there are links on this particular slide for those. The other really thing that we embedded was this open publishing within our approach to the work we did. And we based this around the FAIR guidelines, which are principles that were developed for actually archiving data in a sustainable way. And really, they can be applied to any type of resource. So we took these principles, which are making your resource findable, accessible, interoperable, and reusable, and we use this for all of our resources. So we are going through this process of archiving everything that we've done into open online repositories. Everything is also citable. We have got these digital object identifiers, and everything is being centralized through our GitHub organization. So anything you've seen us produce, you can find it in our GitHub organization or linked on our website. So it is persistent, and it will be there hopefully forever, as far as I'm concerned. Yeah, we also developed a document which actually talks about this FAIR publishing approach, which you can actually find a link to on this particular slide. And then other things that we were archiving, just to give you some examples, are things like the code that we used. So some of our data wranglers, which I think Chris is going to talk about more, developed some particular packages to help the researchers with aspects of their data wrangling. And then also things like different materials, so presentations that we did also can be found openly available on our Zenodo community or on our website. And I'm going to hand over to Chris now for the next slide.
Yeah, thanks a lot, Emma. So yeah, essentially what I'm going to talk through are some of the products that have come out of the work that primarily themes 1 and 2 have worked on over the last few years. What we're starting with is something which is sort of, I think, an issue which was found by most of the consortium and continues to be something for most researchers who are trying to do whole UK research, is essentially what data is out there, what can actually be used, and what can therefore serve multiple long-term research. And essentially what we've come up with and what we've now published in NIHR Open Research, and is also on our Zenodo as well, was a research and data infrastructure horizon scan of 18 different data providers and their subsequent infrastructures, and providing some more practical information on how to actually access these data. There are lots of up-and-coming data catalogs, such as the HDR Gateway, which is mentioned here. There's obviously the National Data Library, which is now being discussed in terms of data discovery and how that can feed into data access moving forwards. But one thing that we noticed that was missing is sometimes the level of granularity of information on those catalogues is not quite what is needed. And actually what people really need to know is, how long is it going to take me to get my data? What's in the data? Can it actually map to what I want to do for my research question? Because often the interface between those applying for the data and the data providers doesn't go into that level of detail. And sometimes data sets are provided through governance, and then you find out you can't actually make use of it for one reason or another. And so what we're trying to do from the outset here is create an initial sort of horizon scan of what currently would be suitable in the space, particularly looking at the combination of primary care data, secondary care data on a health record basis, but also looking at cohort studies such as longitudinal population studies that are consented, and they're developed over very, very long periods of time, of which the UK has got an absolutely brilliant base of infrastructure to access there as well, and how you might want to look at coordinating all of these. And what we did was, for every single one of these, we've given very similar information. So we've been able to explain the area of coverage, what this data actually is, the populations that it's looking at, the types of data you can expect, how you're actually going to access the data. This was one that came up quite repeatedly. One group's trusted research environment does not necessarily look like another's. The tooling that is present in their TREs are not necessarily all the same. And so from the researcher's perspective, it can be quite complicated to try and do a UK study when actually you need to write in 4 different programming languages and explore different clinical code sets, for example. So we've tried to raise all of these as a sort of starting document for people to at least see, what could I go and explore at a very sort of snapshot level. And like I said, the idea with this is that this will be maintained and updated on a sort of semi-regular basis moving forward, because actually things don't change all that often with data providers the way they change data, but there is a move for those who are currently providing sort of downloadable data to move to provide it through trusted research environments. And CPRD, who are on screen here, are one of those examples, who have recently launched CPRD Safe as their sort of new trusted research environment, having for years previously only provided data physically to the data requesters. Next slide, please, Emma. One thing that we've also noticed, and this is why we work directly with the AIM consortia who are using the SAIL data. So SAIL is the Secure Anonymised Information Linkage Data Bank, which essentially provides data for Wales, so anonymised health records and linked administrative data. And one thing that links into that overview of what you are going to be able to have to do with the data, what sort of data you're being given, is, are those trusted research environments actually going to give you the compute and the statistical power you need to actually be able to run advanced machine learning and artificial intelligence payloads? We noticed that this data is absolutely behemoth in scale, particularly if you're doing whole population. It's billions of rows of data if you're doing 20+ years of health history on whole populations. And Wales is only 3.5 million people, and yet there are 20 billion+ rows of data for that population, because it's got everything that's happened on those people in their interaction with health services over that last period of time. In order to harness the capability of those data sets, you have to accelerate the hardware that's provided by those trusted research environments. Using something analogous to a laptop simply doesn't fit the bill. And so what we did was we, through direct sort of conversation with our counterparts on the AIM consortia, we actually developed a new graphical processing unit, so GPU framework, which essentially allows people to make use of a new compute node, which essentially speeds up analyses. It doesn't just speed it up, though, it also allows us to work on a basis where they can use a particularly dedicated piece of hardware, which means they're not taking away from the rest of the trusted research environment, because somebody who is trying to run something particularly large scale can sometimes take up more of the capacity. So this provided dedicated resource for them to be able to run their work. It was particularly good that we ran this through a Jupyter Hub solution, because that is an open source framework for the way that this is deployed. It means that there was no extra cost to the end users for us bringing licenses in for this, just the time they needed to use on the actual GPU cards themselves. And what it meant was that the machine learning frameworks were actually being able to be deployed onto the data, rather than them trying to search as a workaround on sort of lower level compute that normally is provided by trusted research environments. Now, this is a sort of best practice that we did out of SAIL, and our advice would be that this sort of solution could easily be replicated, because of the open source nature of the software deployment, across other TREs where GPUs might be needed, or even where high performance computing may be needed as well. Next slide, please, Anna. So moving on to some of the work of theme 2. So on behalf of my colleagues who worked on this, essentially moving from that infrastructure conversation that I've been talking about, which is very sort of nuts, bolts, disks, that sort of thing. This is actually about how do you actually clean up the scale of the data that we were looking at in order to make it usable for the research into multiple long-term conditions. Drug coding, particularly when you're looking at 59 plus conditions, which are sort of the conditions that are coalesced around to look at multiple long-term conditions and whether somebody has 2 or more of those, are incredibly difficult to harness, particularly because in each nation of the UK, they are set up differently. Different coding structures are used. And what was needed was a mapping between all of the data providers that the consortia were using to be able to actually say, oh, okay, so a drug in this particular data set is this in another. And it also allowed them to consolidate around a validated, clinically validated code list for drugs that are present in the data for medication-based science. So this was early on done with the Optimal Consortium, who are working out of the University of Birmingham. And essentially, they were looking at CPRD data and also data that is in-house within the University of Birmingham Hospitals Trust. And what they were looking to do was map drug codes to the conditions that were of interest for the research, and then obviously consolidate that into a validated list, which is then best practice moving forwards. What you're then left with is a code builder tool, which allows you to sort of dig down into this validated list without having to search through thousands of codes yourselves, match to those conditions, and it provides a much more efficient starting place as part of systematic data curation to actually launch into best practice in clinical coding and specifically drug coding in this case. Next slide, please, Emma. And this was developed essentially by our colleague Rachel Strickland, who, working with myself, we were looking at how to support the understanding of the data that has been provided to research consortia. In some ways, that needs to happen before they've even seen the data. And this is another part of the challenge, really, with trusted research environments and the way data is provided. Metadata is obviously very easily available through constructs like the HDR Gateway, but very rarely do you ever get to see the individual table level values and information that allows you to see which variables map to what your concepts are and therefore how you actually roll in analyses out. So what Rachel was able to do was actually create an R package which essentially scans and maps the metadata at variable level onto research concepts. So in MELB, for example, their particular area of research needed to be mapped so they knew which bits of the data sets of interest they could actually use, again, accelerating their starting position on a data curation basis to ensure that once they actually got access to the data, they knew exactly which tables to use in advance, rather than it taking them months to have to go through all of that moving forwards. And this is, again, something that could be adapted and it could be made usable by other data sets as well, but it was starting with SAIL as an example because of the 90 odd data sets that are available on the HDR Gateway and the metadata that is attached to those. As it says on the slide, this essentially demonstrates how the centralized coordination of this sort of pre-research essentially can alleviate the burden on those research teams in having to analyze and work out which data is most usable for their research settings as part of inclusion and exclusion criteria. And this has been very successful. And as you can see, this has now been peer reviewed and published in our OpenSci. I think that's over to Mon now.
Thanks, Chris. So just a last formal presentation, but I just want to say, listen to you and Emma. You can see that actually there are so many materials that are being left. And if we were starting this program again tomorrow, these uses, these resources would be so helpful to a new program. Because one of the things I want to say is that, this has all been a complete experiment. And I know that science is always an experiment as we go back to our childhood days in school. But the real seriousness behind this is that, how long were these projects going to last for? How long would the RSF be a support to these projects? And I think one of the things that we can say is that actually we were really trying to promote I think transdisciplinary. So research that you really you could not tell what backgrounds people were coming from. They all merged together and they were working collaboratively. But this type of research, interdisciplinary, transdisciplinary research, actually takes time to build trust and collaborate. And I think we saw that in we have to remember that all the collaborations were collaborations themselves, and even the RSF was a collaboration between 3 organizations. So we had a lot of real building to be created here. It took time to create the right skills to the collaboratives. And again, I think this was a big learning, and we helped to support this in the early days when the RSF first started. You know, what skills do we really need? You know, data scientists are only one type of the collaboration that we're talking about. And even within data scientists, there are various skills. Being data ready, as Chris has said, you know, this takes time, and everyone learned through this. And we were able as an RSF to be able to take those learnings, pick up the sticky problems, try to address those problems. And some of the resources we've created have actually been a solution to that. But also some of the conversations we had with the data providers during the time. As an RSF, we were able to do that on behalf of many collaboratives and get perhaps unstick some things in a different way. The communities that have been built, and I just want to say something very strongly here, that we have 2 groups here really. We have alumni of the early career researchers, which is really important. You know, the future of this type of research are the early career researchers themselves and that network. And I really want to, you know, push this to say that community needs to keep itself going, whether that's done externally or whether you can do that within yourselves. The second alumni group we have really, I would say, are our patients and the others who have been involved in the community of practice. I personally have seen so much growth during this period of time, thanks to the support of my colleagues within the RSF, of people that have joined a world that is new to everybody, and that's including the patients and the carers who have come through a long journey here. And we must maintain this skills and expertise, because AI research is not going to go away. Now, there's been a particular interest around MLTC, but the skills that this group, and those not just in the community of practice, are there as a legacy, and are a really strong legacy. And I plead to you all to keep that group going together and keep your connections going. The research support facility brings some kind of agility, and I witness where my colleagues such as Rachel and Chris were able to go in and problem solve, and Marwish were able to go in and problem solve. They needed to be flexible to be able to go and work with different research collaborators who had different needs. If they didn't actually provide hands-on support, when sometimes they did, they were able to open up doors to other people. So the idea of doing that, connecting across these 8 different collaboratives, was a really important thing, and having those skills around to be able to do that and open up doors to access other things. And not all the AIM consortia had the same need for that expertise. Some had expertise themselves, which actually they willingly shared in the ECR networks and so forth. But this idea that there is not one, you know, not everybody needs the same thing, is really important learning to me. Could you move on to the next one, please, Emma? We have to reflect back that actually, you know, it was not long out of COVID. And I know there's obviously at the moment there's a lot of reflection on COVID, but when we started this whole collaborative, many of the collaborators were unable to meet each other. There was still this concern. I remember us having our very first conference where we had in Birmingham, there was concern about bringing people together. Some people did not want to come together, particularly our members with lived experience, with multiple long-term conditions. You know, we had to be really flexible. There is nothing like meeting people face to face, and I think as the time's gone through over the 3 years, you know, people have met, and I think that builds very different relationships. But I think what I've learned from this is actually you can bring people into hybrid spaces, and it does have great benefits. And the skills of my colleagues at the Turin, I've learned a lot about how you can do this really well, and how I've, you know, also been involved in other projects where it's not done so well. So actually we've learned a lot about how you can connect in this new world where I not necessarily be face to face. You know, support and access though to do that and to do it well really does require expert remote facilitation. And as I say, I've learned a lot from my colleagues. So bringing the communities together has been a great addition as we've moved through the programme. The human infrastructure roles, I think, are also key to success. I mean, we must never underestimate, you know, people externally will often think, oh, it's about the researchers, it's about the PIs, it's about the people doing the, you know, interrogation of the data. That never works without the program managers, the community managers, the people that lead the PPI leads. And I think one of the things we have to continue to make sure is that in grant funding, those posts and those people are funded. And fairly recently, we brought the program managers together. We brought the project managers, program managers together at the Turing. And it was quite interesting for me to recognize that some of these people who are delivering very large projects are actually working very part-time roles. They also have an eclectic mix of skills, and they come together as a group, but there is no one kind of size fits all again with who are these people. But then we have an amazing bunch of people who have brought together, you know, diverse communities to make that happen. And those roles are as equally as important, and funding's required, adequate funding's required for those. Moving on. So for greater impact dissemination after grant, that also needs resourcing and staffing. And I just want to sort of reflect on this, because I feel I'm involved in another project outside of AIM, and it's been really, really an important thing to me, is that we tend to sort of front load. We worry about, so this is the same for all research cycles. There's a lot of concentration on writing the grant, getting the grant right, you know, then getting your staff in place. With data projects, it's about getting your data, preparing your data, interrogating that data, learning from that. But actually this takes time. And I think at the end, there is so little emphasis put on the impact dissemination. And, you know, speaking to my colleagues across all of the collaboratives, you know, this is something that is, you know, needs to have more time. So the so what bit of research, the impact, the implementation, how do we actually move things into policy and practice that we're learning is really key. And, you know, I've been having discussions with Mario and others about, you know, we need to be doing more facilitation of this, and absolutely talking to it, you know, the ears wide open, pushing at an open door, that how do we really maximize impact? And given that this was an unusual approach to doing research, I think, you know, we've got now very narrow windows with all of you, all of you that are in the consortia, to really get messages out and to learn from that. And that would be a travesty if we didn't have sufficient time to actually do that. So it is really, I think, enabling that many of the consortia have got extensions to actually help them with that piece of work. And one thing I would also say is that at the moment there isn't a policy unit for multiple long-term conditions. Not sure where the future is going with that, but those areas that do have policy units, you can see that they're actually really helpful to support projects such as something as large and a large investment that we've seen with the multiple long-term projects here. And one other thing I'd just like to say is that I'm taking out learnings to other places, and I'd like to thank those consortia who are involved. We're going to Digital Rewired next week, 4,000 people going to that conference. You know, people from the NHS, people from social care. You know, we need to translate our messages, our learnings out there so it makes a difference to patients. So when patients say to you, well, what difference will this make to me tomorrow when I go and see my GP or I see my consultant at the hospital, that the learnings can actually make a difference to people's lives and also to prevent conditions. So I'm just going to sort of wind up very quickly with a few more slides on behalf of the team, but we have produced 3 case studies. One has already gone live this week, but we decided that we will create 3 case studies, learning from the consortia and the work that we've done. One has been, as Chris has alluded to, about data access. One is about what we've called research capacity and capability building. And the other one is actually about, you know, how have we engaged and how can we be representative with the people that we engage. And we hope that these will be a legacy for future programs, and they will soon all be live. As I say, one of those, the green one, is live now. Emma, the next slide, please. I think I alluded to the fact we brought our project managers together. It was a great experience, and I think yeah, it's left me thinking about, you know, the careers of project managers, how they get there. It was an interesting mix of people, but the roles that they have must never be underestimated as to how complex they are working in complex environments. And there is a blog post there, and thank you for those of you that were able to attend that day. The next one, please. One of the things, again, that I've learned, as I say, I don't think we can ever say we stop learning, but from working with the Turing Institute, the open science goes really, open is the word. And one of the things that we did at an early stage, it took us some time. It was quite a long journey reflecting back, but we wanted to create some images that were going to represent this program. So these Scribe era images were created with using a designer, and I think they reflect all kinds of aspects of the work that we've done. And these are open. They are available. They are online to be used, and you can use them. They're not our resources. They're open as much with that open science. So please do have a look. If we move on to the next slide, you'll see that there is a link to where they are. But all of these illustrations are available. Please find some time to go onto these web pages. Every seminar you've ever seen, any output that's ever come out of the RSF, publications that are coming out from the research collaboratives are all online, and they are openly available. And I think my big wish to all of you is that you access these and you tell other people about it, because this is the way that we're really going to get some sustained legacy from this. We will be having our final AIM newsletter at the end of this month, so please watch out for that, and any contributions still would be delighted to see. And then finally, if we just pop the last slide up, this is us once again, and would like to thank all of the collaborators on the RSF. We've had some staff move on to different roles, gain promotions, all sorts of things, but this is all the names of the people that have been involved in research collaboration, so of the RSF. So thank you all. Many of you are on the call, and I think we're finishing there, Mario. Thank you.
Thank you, Emma, Chris, Mon, very insightful presentations. I'd like to open the floor to questions. If there's anyone who'd like to raise their hands, I've got some questions as well that are coming from the chat. Otherwise, I can start with those. Let's start with those. So I got a question from a public contributor. As a public co-applicant in an AI project outside of AIM, how can I tap into the extensive PPIE community? And more broadly, how do we keep the community going for other NIHR AI research programs? So it's very much around these legacy aspects, and how do you sustain those networks and those communities that have been developed through this work? Would like to tackle this answer among the speakers. Emma, perhaps you want to give it a go?
Yeah, I can start. So yes, so continuing the PPI community of practice is something that we've wanted to really make happen. I have to say we have been struggling. We have been meeting with different organisations. We do have some interest in keeping it going forward, but really it's about creating a group of leaders that can lead things forward. The resourcing that we actually need to keep it going are going to be things like a little bit of money for admin, things like that. So I think the overall cost is going to be quite low, but it's actually having an organisation to take it on, like AIM RSF has been the administrator, the sort of driving force behind it that has kept it going. And when communities don't have that, they're very, very difficult to continue. So we are still kind of working on that particular aspect to kind of maintain it. But I do think we also have so many resources that we can also, as we've been saying, they're all openly available. We've been sharing them with other PPIE communities as well. So the kind of legacy of our PPIE community of practice will live on in other PPIE communities. So even if we don't get a solution for this particular one, then we will be sort of have an impact in other communities, I feel.
And Emma, we are having those conversations with the other organisations. So only speaking to HDR UK, you also have communities and so forth. So there are still many conversations going on, colleagues in NIHR as well, and their communities. So still working on the efforts of where to take this. But the more that we get the testimonials from you folk that say we really need to keep this going, I think we should capture that, Emma, because I think it's not built up overnight, and it's taken a lot of effort. So thank you for the support that you're giving us.
Thank you, Emma. Thank you, Mon. Mike.
Hi. So Oh, it's very, very nice overview of the things that have been done for AIM. And just I got a comment and a question. And the first comment was, I think there might be other things that are done that are kind of have like been associated with AIM RSF. For example, Julia Tomba was running a fairness in AI survey of patients, and most of those patients were AIM consortia patients. And there's a manuscript coming together out of that we reviewed last week. So it'd be good to capture that. And that sort of goes to my more general point, is that I think it would be really nice to capture outputs of the AIM consortia that aren't from the RSF, or that are maybe not even remotely associated with the RSF, just to get it all in one place. Is that something that would be possible?
We do. Thanks a lot, Mike, for that. We do actually have that on our website. So what's on our website is any publication that is coming out from AIM, and you can still send those to us. We can still put them on the website, sort of going forward as well. So Batul has been really involved in the archiving of all the work. So she's really our central contact for that. But yeah, I'm also working with Julia Tomba at the Turing. So I'm very aware of that work, and I think that's amazing that that's kind of going forward. So we'll hopefully steward that as one of the other publications coming out of the AIM program, because I think that's really valuable work.
Yeah, that's great. Thank you.
Thank you, Mike. Any other questions from the audience? Not sure I can see hands at the moment. There are quite a few people. Okay. Sort of chair prerogative, then I'll ask a question, if that's okay. You talked about capacity building and sort of early career researchers. You mentioned that the definition of early career researchers, you left it quite open on purpose. If you were to identify some benefits and challenges in the approach, what would you say those are? I'm quite curious to know.
So definitely the challenge of creating the ECR community, once we got over the defining of it, I think, was the time that early career researchers have. They're very focused, obviously, on actually doing their research, but actually they all really need support with their career. They need, you know, for example, I ran some workshops on grant writing. Well, they've not done grant writing before, so it's like that is really valuable training for them to have, in addition to the research that they're doing, but also like working very closely with our particular experts like Rachel, like Chris, who are working on kind of data wrangling, data issues. That also is really, really good training for ECR. So there was this conflict between and I don't mean this negatively, PIs telling them that they got to get on with their research, which is what their actual job is, but actually us saying, you know, come to our seminars, come to this training, you know, this is all the things we can offer you. So there was this sort of conflict there, this challenge all of the time with trying to bring as many of the ECRs towards the training, towards the capacity building part of AIM RSF. I've now forgotten what the second part of your question, challenges and was it benefits?
Benefits,
Maria?
Yeah.
I mean, the benefits was actually the connections made in the network. I think Mon touched on in her lessons learned about the face-to-face contact. And although I'm very, very into hybrid collaboration to enable more accessibility and inclusion, we really found that bringing the ECRs together really spurred on the connections. And actually, they have really driven me into thinking about solutions to continue the network. So we're actually with our rep committee, we're developing a private LinkedIn group to kind of keep the connections together for the ECRs, because there was about 70 ECRs within the network, which is quite a big group actually. So trying to keep them together as a group. But we're also at the moment trying to link up with an ECR community that's been created in HDR UK, because obviously they are doing very similar sorts of research, working on similar issues and themes. So we're trying to kind of bring the two together to kind of bring those communities into kind of more of a cohesive community. So yeah, I think that benefit is just the connections that have been made going forward.
So is the benefit for the early career researchers themselves in
Very
nurturing
much so.
those connections?
Yeah.
And do you feel, sorry, Mon, I'll come to you in a second. So do you feel that this will have sort of systemic implications as well?
I do, because all the people that you meet in your academic career, you actually go through your academic career with these people. So actually creating more connections for the ECRs in AIM programme has made more opportunities, more collaborations for this group. You know, these are the people who they are going to become our next, you know, research leaders. So it's sort of driving them forward to collaborate together, to write those grants, bring in funding, bring in new research for different organizations. So it spread, the benefit spreads out from the sort of initial activities that we're doing with them.
Thank you, Emma. Mon, please.
Yeah, I think I've got a couple of comments, and one does go back to the fact that I think I challenged ourselves in the early days, as I often do, and said, I don't know about the term ECR in the community we're working with, because what the research collaboratives have done and what became evident very early is that everyone's learning in this. This is not a long legacy of, you know, many, you know, we do have some obviously PIs that have been working in the field for a long time, but a lot of people in the collaboratives, this was new to them. So, you know, we had GPs in many of them who were coming to this, who wanted to learn, who didn't sort of define themselves necessarily as an ECR. There were people from public health. So actually that definition was quite difficult to work out. And I think we had to be quite sensitive about what we meant by that. So that was my first point. The second one to me is that if we were going longer, and this would be something that I might put to yourselves, and that is, success will be, and I don't want to feel like I'm a football manager trying to take a player from another team, but the success will be if we see people move from one collaboration to another as they, you know, as their projects are moving. And there has been some movement. We've seen a couple of ECRs move from one to another, which doesn't mean to say, you know, that we don't own people in this community. It's lovely to keep them in the community. So success to me would be if people were moving across, you know, the early career researchers were moving across consortia, and success again could be measured in the future as how they move to being in and named as co-Is in future grants and so forth. And we ought to capture that, because it's not just about skills, you know, to do the job. This is about their careers and about building this bigger community. So that alumni is a really important alumni, as is the alumni of our PPI members, and also the PIs. I mean, I think it's really important that we keep this community together of the PIs, because that's how we will get greater learning.
Thank you, Mon. Any follow-up on this from the audience? I'm conscious of time. We have probably 5 minutes left, but to correct me if I'm wrong. Chris, may I sort of turn to you for a question? You've been working with colleagues in what looks to me, at least, a very crowded space with a lot of development, both in the data field, but also more specifically around the development of AI and AI models, etc. What would you say the RSF contribution has been, and how is it nested into this broader ecosystem of incredible developments over the past few years?
Yeah, so I think essentially the coordination of how to get the most out of the data that's lying across the UK and essentially can be made available for this type of research is probably the first thing, not just to our sort of here's what's out there approach with the Horizon scan, but also just actually listening to what each of the consortia are trying to do, offering advice with computational deployments where we could, and getting ready for what the next wave is going to be, because analytical deployment for UK-wide research is going to change quite substantially in the next 12 months. I'm currently at the Data and Analytics Research Environment, or DARE UK meeting, which is kicking off the funding for the next 2 years to create a network of sites providing health and administrative data for research. And essentially, we could, if all going to plan, in the next 12 to 24 months, have the 4 nations of the UK actually network together so that a researcher can actually deploy queries onto the data. So utopian vision, but at the same time, it's what we're funded to try and achieve. And so at the moment, a researcher has to go to each nation, and in some cases, more than one provider per nation, to analyze data in its own right, get answers out 4 times, apply 4 times, and then matter analyze what they can afterwards. And that's with the data not being standardized in any way, shape, or form. And so it is a big task for people to be able to do that sort of scale of research. So we're really hoping that this is going to move things forward. And AI regulation is a really interesting one. We've been going through work at the moment, and we've spoken to a few of the consortia about this, about the deployment of model onto data versus the retrieval of model from data. Deployment of AI models onto data generally is acceptable because it's understood what the model does before it comes in. It will give you an analytical output, so you can retrieve those research outputs that have gone through standard statistical disclosure control to make sure you're not bringing out anything disclosive on people. But the model itself can learn so much information about the data that it becomes almost as disclosive as the data itself. And so there's a big piece of work to also protect against what AI can do in its own right within a TRE, not just around data that's out there in the open already, and make it as safe as possible, but as efficient as possible for people to actually do their research, which is another part of working with data providers to get their heads around the efficiencies that AI will bring, but also what they need to put in place rule and policy wise to ensure that it's not putting barriers in place to stop AI being deployed, and that people understand what the outputs will actually look like that it derives.
Thank you, Chris. Very insightful response. How much time do we have, Batu? Because I think my clock is running 2 minutes late.
We have just 2 minutes, actually.
2 minutes, okay. Thank you. And well, I guess it's probably time to draw to a close, and perhaps with one last question, maybe Mon, if that's okay with you. You've been working across those different areas of the RSF and very closely with the collaboratives. My question to you is, how do you see those different components coming together as something more than the sums of the individual parts to address the so what questions that you asked at the very beginning?
Yeah, and I think this goes back to one of the points I alluded to earlier. I mean, we don't necessarily expect everyone to have a whole lot of outputs that we're suddenly going to change the NHS tomorrow. Wouldn't that be marvelous? But we're not going to be in that position. This work is just ongoing. So as far as I'm concerned, there are 2 layers. One is how we keep this whole community together, and particularly thinking about the collaboratives and what they've focused on, but also, are there learnings from there for future research calls? How can they cross-collaborate? I know Aziz is speaking to working with the PIs next week to sort of think about those learnings, and then how can we actually influence policy? This may not be about results, but it's about the policy of AI and research and funding for this type of research, because the process that we've learned during this is equally as important as some of these outputs. So I think this group is so good and so fertile to influence the future of research in this area, and that's what we've got to capture, Mario.
Thank you. I think the key message there, and which I'd like to conclude with that one, is that the journey is the outcome in itself. Thank you very much for these closing remarks. If there's no other questions, I'd like to thank you, our panelists. I'd like to thank participants. I'd like to thank all the colleagues in the RSF and the consortia, early career researchers, PPI contributors, everybody who's made so this experiment is such an exciting enterprise to be part of. And I wish you all the best for the future and the rest of the day.
Thank you very much,
Bye,
everybody. Thank you, Mario, for chairing. Thank you.
Bye.
Bye.